Hi, I'm Kirsten Gillibrand, Senator from New York, and I'm here to join the Momversation. Hi, I'm Kirsten Gillibrand, Senator from New York, and I'm here to join the Momversation. Right now, obviously, we're in the middle of a very big healthcare debate in America, and my biggest priority is to make sure that every child in America has access to quality and affordable healthcare. Some of the things that I'm most focused on right now is children's nutrition. I'm on the Agriculture Committee, and we're going to do the children's nutrition bill this year. What we need to do is focus on how do we prevent our children from becoming obese. And there's a couple of things we need to do. First, we need to give them better quality foods in schools. One thing I want to do is ban trans fats in all schools all across the country. I also want to change the kinds of foods that our kids get when they eat school lunches.
Hi, Senator Gillibrand. You know, you are a Democrat, I am a conservative, and popular stereotype dictates that we are to hate each other beyond all reason, and they're just going to be so disappointed. Maybe it's just me, but I've noticed that with regards to the increase in adolescent obesity, childhood obesity, it seems as though it's less related to genetics and more related to personal choices. We also need to have the freedom to make those healthy choices, and I think that's just like one little thing about which I disagree with you on, and because you were talking about banning trans fats and stuff.
I am all for nutritious lunches. I don't mean to minimize those topics, but the topic at hand that I would love to hear your opinion on is healthcare reform. My own experiences with insurance have been maddening to say the least. Henry had a case of pink eye that they decided was a previous condition. What? So they wouldn't cover it because that's a previous condition, pink eye. The doctors just laughed at that.
I've been personally affected by the crappy way that insurance works in this country. And I think it's a crime that 47 million Americans live without insurance, meaning that they live on the verge of catastrophe every day of their lives. My husband and I own a small business, my website, and when he left his job, we all had to apply for private insurance. And me and my husband and my daughter were all denied private health insurance for pre-existing conditions.
Well, Heather, I appreciate the point you made very much. It really is unconscionable that we have 47 million Americans who don't have access to affordable health care. And what we're trying to do is make sure that families are not one illness away from bankruptcy, and making sure that their insurance industry cannot deny coverage because of pre-existing conditions.
I really hope that you see the fiscal and administrative dangers that are in the healthcare legislation that is currently being proposed in Congress. Honestly, I just think there are just so many things that we can do to right our current healthcare system instead of taking that incredibly dramatic approach that is in Congress right now.
Dana, I really appreciate the point you raised as well, because healthcare reform is a bipartisan, urgent need. Everyone in America needs access to affordable healthcare, whether you're a Democrat or whether you're a Republican.
I feel that the reform that is currently being proposed is right on the money. In fact, I don't think it goes far enough, which just shows you where I'm coming from. I would be all for it, just single payer, just go. I would love to know how you fix an incredibly corrupt system without something drastic.
I just think that there are so many things that we can do, steps that we can take right now to fix our system instead of doing all of that. There's just a line that I don't like to cross when it comes to the government making decisions that people have the individual liberty to make themselves.
That the greatest country on earth doesn't protect, its most vulnerable citizens, that people who get sick have to worry about whether or not they're going to be dropped from their coverage. I really do think that this could be the legacy of our generation, is to provide health insurance for everybody.
Thank you so much for welcoming me to Momversation. It's been a great opportunity to have this conversation with you. about an issue that all of us care very deeply about. And hopefully with the right kind of advocacy, we can pass healthcare reform that reforms the insurance industry and lowers costs for everyone so everyone has access to good, affordable healthcare.
Join the Momversation at momversation.com.